A 53 years old man is due to undergo the splenectomy as a treatment for a refractory hemolytic anemia. The underlying pathological basis for hemolytic anemia thought to be type 2 hypersensitivity response. Which of the following mechanism is best described of the process? That means type 2 hypersensitivity reaction, we have to find out the pathology behind it, or what is the pathology or reaction of type 2 hypersensitivity reaction. Here the options are deposition of the immune complex, cell mediated immune response, IgE mediated response, formation of the autoantibody against the cells surface antigen, and none of the above. So which type of reaction occurs in case of the type 2 hypersensitivity reaction? And here we can see the different type of the hypersensitivity. First of all, the type 1, then type 2, type 3, and type 4. So type 1, type 2, type 3, and type 4. And here we can see the name type 1, it is the anaphylactic. That means in case of the type 1, there is the anaphylactic reaction occurs. That means the histamine, serotonin, and other substances are released from the mast cell. Type 2, cytotoxic. Cyto means cell, toxic means toxic or toxic. Toxin, that means the toxic production against cell. And type 3, which is the immune complex. What is immune complex? Immune complex, that means the antigen and antibody, they are binds together. And type 4, it is the delayed type. So again, type 1 anaphylactic, type 2 cytotoxic or cell damaging, type 3 immune complex, and type 4 delayed type. Now see again the different type of the hypersensitivity: type 1, type 2, type 3, type 4. First of all, in case of the type 1, here we can see the allergen, and this allergen binds with the mast cell, and degradation of the mast cell produces different type of the chemical substances including the histamine, and it causes the reaction, and this is the type 1 hypersensitive reaction. And in case of the type 2, what happens? In case of the type 2, here we can see in case of the type 2, there is a antibody against the cell antigen, and this antibody binds with the cell, and finally it causes the cell destruction. For this condition, it is known as the cytotoxic. It is the cytotoxic because it binds with the cell and destroy the cell. And type 3, it is the immune complex. That means the antibody circulating, the antigen also circulating. So the antigen antibody complex, they form a complex with each other, and finally they circulate in the blood. So type 3, it is the circulating, and type 4, it is the delayed type or cell mediated immunity. So which type of the type 2? It is the cytotoxic. What is the type 2? It is cytotoxic. So you can see the antibody against the cell surface antigen, and it binds with the cell surface, and finally destruction of the cell. Other options here, such as the immune complex formation, it occurs in case of the type 3 hypersensitivity reaction. Cell mediated or delayed type, it is type 4, and IgE mediated, it is type 1.